Hi, welcome to my new podcast episode. This is Poorti Kathpalia, a science communicator by profession and a PhD in neurobiology from AIMS. Today I have with me Mr. Ashish Gourav. He's a data scientist by profession and works at a market research firm. He has studied at IIT Kharagpur and Indian Statistical Institute, Kolkata. He also runs a YouTube channel where he talks about books, economics, and data science, which is Honey of Knowledge. So I welcome you, Ashish, to this special episode, which is on mental health, as today we are celebrating World Mental Health Day.
Yeah, hi, Poorti. Thanks for that generous introduction. And if I may pitch in, I also do a lot of behavioral work, so that gives me a good standing to talk about mental health.
So, can you tell me a bit about this behavioral work that you do?
Yes. So generally, when you want to understand how a consumer buys a product or what are the drivers and motivators for someone to buy or not buy or change their choice, uh, then you have to understand their psychology, uh, how and why they do what they do. So there comes a lot of behavioral understanding of the consumer. So yes, it's not very intense or rigorous because data is at the heart of it. But still, if you do not understand this aspect, that data will not tell the complete story. You also have to have some empathy with the behavioral side of the surveys and market research. Only then your analysis and conclusions would make sense. And apart from this, I also have a natural inclination towards all things behavioral. So even by education, I studied economics at IIT Kolkata. So in economics, there is a branch called behavioral economics. Now, I'm very fascinated with that. And so behavioral economics deals with the idea that when you leave the assumption of rational consumer, what will happen to the fundamental uh, conclusions of economics, microeconomics, in specifically microeconomics.
Yeah, that reminds me of Dan Ariely's book, Predictably Irrational. So that's
Mm-hmm.
one side of psychology and behavioral research. Yes, but
Mm-hmm.
when we talk about World Mental Health Day, the major
Mm-hmm.
concern is about the growing uh, cases of depression, anxiety in the public, and especially the youngsters. So
Mm-hmm.
almost every day or two, I hear about people having panic attacks, like students having panic attacks before their exam or at a
Mm-hmm.
workplace. So I've done a PhD. I work at a research institute. I interact with PhDs a lot, and the percentage of a PhD suffering from a mental health issue going up
Mm-hmm.
to the level of becoming clinical is very high, like 80 to 90%. So I
Mm-hmm.
felt this is the day when we should create that awareness about mental health. And
Mm-hmm.
it's unfortunate that people who are even educated, they also are have that stigma that they're not able to reach out for help when it is needed. So
Mm-hmm.
I hope by hearing to this podcast, they will get that courage back, or will be able to fight that self stigma that is there to seek that help which they need. Would you
Mm-hmm.
want to add something to that
Yes,
Ashish?
yes, yes. So, if I may, uh, how has been your experience with mental health awareness, as in the kind of people you talk to, your friend circles? How aware are they about mental health?
So if I talk about my experience, then I have been very vocal about my mental health. That so I've had generalized anxiety as a child, and it was only until my post graduation days that I got treated for it. So obviously until that point I had no idea what I've been going through. So then, because I did not know it myself, I could not basically talk about it. But after that, especially when I started to teach, that is post my PhD, in between classes, if there is, like, students want to talk about something else, they don't want to study,
Mm,
so I have
mm,
brought up mental health.
mm,
And it so appears that students could relate to it, because they are at a stage where many of them have experienced not exactly clinical symptoms, but the stress because it's there, so they can feel that now they can or they are at a risk of developing a mental health disease. So that is, I think, where the awareness from my side started. And then after started working as a science communicator, because again I was in an environment where I was surrounded by PhD students and I could see the level of stress that they are going through. I I mean I have more of one-to-one interactions where people are
Hmm.
feeling safe in that space when I can talk about my own experience, and then they also feel open to speaking about what they're going through. So in a way, via that dialogue in which I'm talking about my experience, that creates a bit of self awareness that yes, this is not something which they are going through alone, because that is one thing which a person usually feels. Nobody can understand them. Gets away from their mind. Ki, okay, I'm not the only one who's facing this. There are others also out there, and also they have seeked help, treatment, be it medication on or therapy, depending on your condition, and then it is possible to come out of it. So even
Yeah.
a simple conversation can create an awareness. That is what
Hmm.
my experience has been like.
Yeah. Must have been difficult coming out and talking about yourself personally, I guess.
So I also thought of starting a mental health support group because the idea behind it was if I can nucleate a support group, psychologists.
Hmm.
So there are counselors on board, but then the psychologist or the counselor may not be available each time because then there
Hmm.
are so many people. So having a support system outside that counselor is also needed. So if you have a
Hmm.
small support group, earlier there, now you have a friend circle, but those friends are not equipped to talk to you in a way that it won't trigger you if you are feeling like you are in a panic state. So if you have a
Hmm.
group of people who are aware and who also have some basic knowledge of how to address such an issue, or when somebody is feeling panic, how to basically calm them. So to
Hmm.
nucleate such a group is one of my ideas to implement in the near future. That,
Hmm.
I go to a place, say a college, and
Hmm.
students who are interested, who need, either you are interested to provide support or you need support. So why not combine them together and, just
Hmm.
start a small support group. They can then
Hmm.
kind of rope in other people, and even if they
Hmm.
after some time if they leave, there would be other people to continue to have that support group activity like that.
Yeah, I mean, this idea sounds very good and noble to me. I mean, you must try to do something about it. I would be really, really waiting to hear something about of this sort coming from your end. Which brings me to a question, that how you look at mental health and general health, as in what is the perception of people about these two things? Because in my mind, based on my personal experiences, I feel mental health and general health can be clubbed together as health. But people generally bucket them in different categories. That if you have a malaria, you have a different kind of a disease, and if you have a depression, you have a different kind of a disease. By malaria, you will not be ostracized, or you will be looked at from a kind of a taboo lens. But if you, let's say, have a depression or maybe even, let's say, dementia, you will be looked at that this guy or this girl uh, is not fitting in the society. So this is the part which I want to understand from you. If you can share a bit of technical idea about it as well, or is it just a perception of people, and there is no technical distinction between mental health and general health?
So if you look at the body, brain is also an organ, right? So it should
Right.
be considered a part of your general health. But right now, like you mentioned, it's true that if you talk about mental health, it becomes a stigma. But that is
Hmm.
true for so many other diseases also. I mean, we should not basically, not bring into consideration other cases where also a stigma exists, which applies to many genetic diseases. So I think the
Hmm.
main issue here is not about just mental health being considered something of a stigma, but these are things which we don't understand. Like, like you talked about malaria, we know
Hmm.
why malaria
Hmm.
happens. We have a treatment for it. But when it comes to mental health, there is so much little that we know about the brain. So
Hmm.
usually the patients, the public, they look up to the doctor or to the scientist to provide them answers. But here, because
Hmm.
we know so little about the subject, we don't have
Hmm.
answers. Like you mentioned
Hmm.
dementia, we don't know the cause of dementia. There are so many
Hmm.
types of dementia which we are still trying to understand. And then there is no treatment for dementia. So it is
Hmm.
like, and then obviously they won't be able to talk about it to other people. Plus, a lot of this also goes back to, I think, historical references where, people who had a mental health disease or mental health illness, they would be considered as or possessed by demon or witches, and all those things used to happen. So from the beginning itself, I think we have come a far way of characterizing them as diseases. So Ashish, can you tell me if you have had any personal experience with mental health?
Yes, so it's like that. I have always been aware about mental health issues since my childhood. Now, my mother had suffered clinical depression 3 times. Now, in all these 3 times, it was a different manifestation in itself. So, for the first time happened when I was not even born, when she was not married. I have like no idea what happened in the first occurrence of that. In the second occurrence, I was very small. I was maybe class 3 or 4, and I have a bit of recollection, and all I could understand from that episode was that mental health is a taboo. That was my takeaway as a kid, that people regard this as a taboo. To me, that was surprising as a kid. I felt that if she is not well, why are people treating her like uh, someone different than some if somebody gets, let's say, if you get a terminal disease like cancer. I somehow felt that she's not treated in that way. She's treated uh, in a way that whatever she has got is out of the world, not natural. And yeah, this was my experience as a kid. After that, the third time when she had mental health issues, it actually manifested into her physical aspect as well, as in her brain got atrophied, and because of the cerebral atrophy, she lost a lot of her motor functions. So she was not able to walk properly, not sit properly. For a good 6 7 years, you can say she was bedridden. And though my father and my family members supported her a lot, after her death, I was not in the best of my mental health condition. And also, as a teenager, these days, millennials and Gen Z, they have a lot to process. So, in the teenage phase of life, you have so much happening around that you always are going through some kind of an issue which will trouble you mentally. Now, I never knew that I'm going through something. It's only now that when I'm able to look back and observe how I was behaving, but only when I was in my, let's say, mid 20s, I realized that my depression is a chronic thing and it needs to be treated. But I never knew that how do I get it treated, because of that stigma factor associated with it. Though I had understood that this is something which needs to be addressed, I could not find the courage to address it. I could not find the courage to seek expert help. But only when I kind of crossed my 30s and then certain things happened in my life, then I said, no, I need to find help. I need to seek out help. And then, because of my age, because of my education, because of my uh, reading habit, as I read a lot of books on behavioral sciences, so I kind of was ready for seeking help. And I believe, from my experience of these many years, that everybody needs a counseling session, kind of a thing on a regular basis. Not, I would not term therapy per se, because the moment you use the word therapy, it kind of like gives you an idea that there's some kind of a treatment going on for you. But no, what I'm trying to say is, even if you do not need some kind of a treatment, even if you're not going through a mental episode, a mental health concern, even then you need to take it out. You need to seek expert help so that anything which is at a nascent stage, which could germinate, gets wiped out immediately. That is why I believe that universal counseling on a regular basis is very important. So you might say universal therapy as well for the wider understanding of the necessity which I'm trying to address. This is where I stand in my personal experience with mental health and its awareness.
So sorry to hear about your mother, and I can't even imagine how traumatic that experience would have been for you. But that made you more sensitive towards the issue. And now, when you talked about having a universal therapy or counseling, I think that sounds like a very good idea. Definitely, everyone needs a therapist. I completely support that idea.
And if I may ask you, how has been your experience with therapy?
So, I've had a mixed experience, to be honest. When I started, I realized that, it made me easy to talk about the things which I have gone through, because very similar to you, I even like when I was a child, I could not understand what is wrong with me, what's going on. A lot of that is the changes that happen in your body, including the brain, when you cross puberty. But then if you are also susceptible to a mental health illness, then it takes a toll, and you can't understand what's going on. So I never had the words to express how I had been feeling my whole life. And the moment I started therapy, I had words. I could talk about it. So it I can't basically express how helpful it had been for me. But then there was a time when I had kind of become like I was not sharing all the things with my therapist. Like most of your relationships basically get reflected in the relationship that you have with your therapist. Basically, I could not address the relationship between me and my therapist, because many of your personal relationships, your romantic relationships, your uh, family relationships, they get reflected while you are talking to your therapist. So it's important to address the particular equation that you have with your therapist. So that was something which was not happening for me, and because of that, I was stuck for a very long time. So I came across this book, which is and it's called as "And How Do You Feel About That." That helped me understand that I have to also be open about how I feel when I interact with my therapist. Not as in feeling about all the other things, but how she is making me feel when we are talking. And once I started to talk about it, I started to having many breakthroughs. So it has been helpful, I would say, along with medication. So someone who had a clinical generalized anxiety disorder, I could not do so many things. So I
Hmm.
never had been on stage in my school time. But now
Hmm.
I've addressed a group of like 100, 200, 300 students in an auditorium standing on stage.
Wow.
And I thank my medication for that. I mean, I could not have imagined doing it.
Amazing.
I did not know I have a different side, a different person inside me, which has been getting suppressed because of my condition. So yes, it has
Hmm.
been helpful, both the medication and the therapy.
Which brings me to an interesting question, that generally when we seek out mental health expertise, we don't understand that there's a difference between a psychologist and a psychiatrist. So would you like to touch upon that?
Yes. So most people, they become confused when you mention this, that psychiatrist is basically a MBBS, MD doctor who has the expertise and the knowledge of writing a prescription to you for the medication that will help you, that will help treat your depression or anxiety symptoms. And a psychologist is someone who would help you via talking. So there are different types of therapy. Talk therapy is the most common one, and I do not have the expertise to talk about various kind of therapies. But in general, a therapist is somebody who is not giving you medicines, but is kind of, talking to you, reconditioning your brain, bringing out your issues. Like for me, it was so many things which I could not express. So I could express them. So the moment you express, that's the first step of accepting and then eventually finding a solution to it. So so many thoughts go in our head that it's difficult to even pinpoint on something which is making us do something or feel something. So identifying those emotions, those feelings, that's where the therapist comes in, and the therapist helps you with that, but doesn't have that expertise or knowledge to write you a prescription or give you any medication. So Ashish, I think
Mm-hmm.
you have also taken therapy. So how has your experience been?
So, as you mentioned in the initial part of the podcast, by education, I'm an engineer. So, that education gives me a kind of a very logical perspective at looking at things. And when I look at a problem, I generally move towards a solution. And I don't understand that there are a lot of times when you have to just ruminate of the problem. You don't have to jump to a solution. So, when I wanted to seek out therapy, it was for me like I need a solution right now. I need it quick, as quick as possible. And when my therapy session started to plateau, because you have to share certain things which you have never shared with people. But the moment those things come out of your system, so the therapy sessions stop making sense to you. You feel as if you have told everything which you wanted to tell. Now, why are you having those sessions? Why are you even going there? Why are you even talking to the person there? How is it benefiting you? So when it plateaued for me, I did something which is not advisable. I strongly oppose that activity or practice which I did. So I started to seek out multiple therapists, and it became like a kind of a routine for me that I step out of a therapist and go to another therapist. Like it's like you have become a glutton that you go to a McD, then you go to a KFC, then you go to Domino's. It's like you keep binging on food. So I was binging on therapy. I was kind of like enjoying telling my side of the story to these strangers because I used to the I used to get the opportunity with all therapists from beginning. So plateau never came with a new therapist. Plateau can only happen with an old therapist. So that was a thing which I would strongly advise against. And the only reason I brought it up was that if if people are new to therapy, they might not be aware that doing this is not right. And because a lot of people don't talk about these things because these are very specific things about therapy. That because in other fields, if you are seeking an expert, you are tempted that if this person is not able to help you, let me address it with some other person. But it does not work in that way with therapy because you are dealing with something which is a very vulnerable part of you. It's how you think and how you decide. So these things have like a very, very fundamental way of affecting your daily routine. So that is why you should like trust your therapist. And if you feel that things are not working out, talk to a therapist that things not working out. Then he or she might be able to talk you out of it, or you might decide to end your journey there, and then you can start looking for a new therapist. But only end your journey when you have that conversation, and then look for another therapist, and then stick with that one. So you can go from therapist one to therapist two, but not concurrently. Now, my experience apart from this is that it has helped me immensely, and uh, I learned so much about myself, which I was completely unaware of. And now it has reached to that stage that there are days when I uh, seek out therapy sessions just to have a kind of a regularity so that the therapist knows what I'm doing, how am I behaving, and my therapist is very happy with my progress. So that is something which I feel that it's really been very helpful for me. And there was a time you did not ask me, but as you mentioned about medication, so there was a time I also visited a couple of psychiatrists, and I was also given a medication which I don't remember what was it, because I only took it for like a week or so, and after that I felt that I don't need it, because they had given it for calming me down or getting things done. And once I thought that I can now get things done, so I stopped medication and stopped visiting psychiatrists. So yeah, this was like my experience of seeking out mental health for myself.
Yeah, so this is the opposite of what most people do in terms of
Mhm.
psychologists, because it's very difficult for people to, talk about themselves. It's a very difficult place. So mostly
Mhm.
people avoid doing that, and I'm like little amused that you could visit so many therapists. Although again, like
Mhm.
you said, it's not a good idea. But the problem is finding a good therapist is really difficult. So I think
Mhm.
your experience might help our listeners to
Mhm.
find a few good therapists. If you have your recommendations, you can probably share with me, and I can
Yeah.
have the list posted.
Mhm. Sure.
And
Sure.
because you mentioned about the medication, I would just want to add on there, because it may not work like that for most people.
Mhm.
I've also done that. I have discontinued medication in between because I was feeling better, but it just came back.
Mhm.
So unless and
Mhm.
until your psychiatrist tells you to stop the medication, don't do that. It feels
Okay.
because when you are on medication, you are feeling better. So you feel
Mhm.
that, because again we know so little about depression and other mental health diseases, that it's
Mhm.
important that based on our own judgment, just decide to stop medication because we are feeling better. Because let the expert decide for you when you have to stop the medicine. And for
Mhm.
many occasions, it takes a lot of time for you to get better. But it's fine. There's so many medications that you have to take for your whole life, like say for diabetes, insulin
Right.
injections. People have to take it. So consider it like that, and do not ever stop your medication before, if you're feeling better. Like you have to feel better. That's the purpose of it. But the
Mhm.
time and duration of medicine, that has to be decided by the psychiatrist. I'm glad for you
Mhm.
that it worked and you had to stop. I mean, you could stop your medication so soon, but that's again not the case which happens most of the time. So I would just
Mhm.
want to, as a disclaimer, that do not stop medication until and unless
Mhm.
your psychiatrist advises you to.
Yeah, yeah. And there's a thing which I want to clear out with you, because, see, I have a history in my family about mental health. So it's a taboo. Medication is also a taboo, that don't take medicines for depression, or else you'll always be sleeping. Those will be sedatives. You can't work, and your life will be destroyed. So what is your view on that? Are these antidepressants essentially all sedatives, or they have some other aspects as well?
So I think it depends on your condition. So
Hmm.
for me, my medication has never made me feel like sleepy or so. So
Hmm.
I think it depends on your condition. So when I was getting treatment, so right now I'm getting treated for depression and I'm on antidepressants only, so they don't have this kind of effect. I mean, I'm like I take it at night, and I mean, I am completely fine. I don't feel sleepy throughout the day, or even my sleep is not disturbed by the medication. But when I was getting treated for anxiety, at that time, I was given a few medication that needed, like, you have to be careful not to take them, say, before driving, or if you have to, like, going out. So that may make you feel sleepy. So there the doctor can adjust the dose and the time when you take the medicine. If it's before sleeping, then obviously, that phase the sleepiness that will come will be a part of your regular sleep. So yes, some medication may make you feel like that, because especially for anxiety, the anti-anxiety pills that are given, those make you calm. So they are inhibiting the brain activity in your brain. So because of that, you may feel sleepy. So again, you can then talk to your doctor and see what works for you, what doesn't work for you. So it's like something which is different for every person, because the disease has so many different symptoms, and everyone experiences the degree of symptoms is different in all the individuals. So the
Hmm.
particular combination of the drugs, the combination of the duration, the dosage, all that really matters.
Right, right, right. And I just wanted to understand one more aspect about it, that when you were talking about medication and its impact, so how likely is it that at some point of time your psychiatrist will tell you that now you no longer need it, or it always it always needs to be continued for your life?
So again, this depends from person to person. So many people, like, there is a strong genetic cause also for depression. So I have seen cases where after a few years the medication has stopped, and so
Hmm.
it is possible that you have to take it for a very short time. For anxiety, like, you had to take it for a week. I've seen cases where after a month the anti anxiety medication was stopped. Then there have been other cases where for depression the treatment went on for a year or two, and then the
Hmm.
person did not need medicine after that. Then there have been cases where a relapse happened, and then again for a very short duration, say, I mean, by very short duration, I mean like a year, you take, and
Hmm.
then you are like, you don't need it anymore. But for certain people where there is a strong genetic history, then the environment has a big role to play along with the genetics. So a lot of stress in the life, and not having a support system, all those things can come together, and it is possible that you may have to continue it for your entire life. It also depends on the kind of how many episodes you've had. So there is a possibility that it will stop soon. There is another possibility that it will not stop. Again,
Hmm.
just listen to what your doctor says, just trust your doctor.
Right, right. And I would like to understand that at what age someone is ready to visit a therapist. As in, I'm not sure if you are aware about it, but let's say a 11-year-old kid goes up to their parent and says that, uh, "Mom, I need to visit a therapist."
So
So,
basically, the child won't know this, that they want to
hmm,
visit a therapist. I've seen young
hmm,
kids going to a therapist because their
hmm,
parents could identify that they need a therapist. Like right now,
okay,
in all schools, there are counselors, psychologists on board, but there the
hmm,
responsibility lies on the teacher, the parent, the guardian to make sure that the child gets the support. So I think
hmm,
that's where awareness comes in. So
that
if
they are.
there is this 2 week period which is usually considered for
Hmm,
even for considered as someone having clinical depression. So I think waiting it out for those 2 weeks or so and seeing if the symptoms go, or if they
hmm.
don't, then do seek help from a professional.
So I will again go back to our earlier discussion on seeking out mental health. What options do we have? Let's say we have understood that now we need help. Now we need to address mental health issues. So what are the options which are available for us? Is it just like the dichotomy of psychologist and psychiatrist, or we have other options as well?
So other options, I would say they work in a combination basically. From my limited knowledge, I would say that you should visit either a psychiatrist or a psychologist, and one person will guide you to the other if required. And then they might also ask you to have some supporting kind of activities, which usually are the first things that your family will prescribe: doing exercise, doing meditation, yoga, and keeping yourself busy and active. These activities add on to the support that you're getting from the medical practitioner or the
Hmm.
professional therapist. But
Okay,
yes, they
okay.
are needed, but they may not substitute for the medicine and therapy. That is what I would want to tell, because usually whenever you talk about, so unfortunately it's like we use the word depressed so recklessly, and
Hmm.
anybody who's feeling low or feeling sad for maybe a day or two would say, I'm feeling depressed, and the immediate response would be that, okay, let's go out and watch a movie, or let's go for a
Hmm.
walk. That obviously that can lift your spirit, that can lift your mood at that time, or for if
Hmm.
it's just a momentary thing, you're not depressed in that case. But if it
Hmm.
like it has been for more than 2 weeks, that's what I use as a criteria for even myself.
Which kind of gives me something to add on to this, that we kind of use so many mental health issues very loosely. Like you mentioned about depression, a lot of
Hmm.
kids would say to you that I'm depressed, but they're just sad. And a lot of people these days use OCD, like I have OCD. But the
Hmm.
thing is, just because you like orderliness, it does not mean that you have OCD. People who have OCD suffer because of that. They literally suffer. I mean, I don't want to get into details because I'm no expert, but I at least have that much awareness to understand that OCD is a condition which is not equivalent to seeking orderliness. I may be a very hygienic person, I may seek out extreme order in how I do things, but I might not have OCD.
True, that is very true. So I was just thinking how religion, spirituality, and what mental health practitioners say converge into one thing, like mindfulness. And we come to that same space via different routes, and how that is
Hmm.
something which is basically good for our mental health. So, most of
Hmm.
us who have been raised in a religious environment, religious household, we've been asked to say these chants or, sit silently and, repeat some mantras. So, all those things are what meditation and mindfulness is about. So I think
Hmm.
whichever path you take, you are, doing something for your mental health, which is what matters. And I just would want to add on before we wrap up this episode that even the WHO mental health guide, which is talks about various exercises that you can do, and obviously you'll have to practice them daily so that they become effective, is that you need to be mindful. So the first exercise that they include in that mental health guide is of grounding. That is, you stay mindful, you stay attached. And in a way, religion or spirituality, be it a guru, like I think all these different routes where you believe in, they keep you grounded. And that is what you need in times of stress. So this is
Hmm.
where I would want to end. Ashish, do you have anything else to add on to?
Yeah, yeah. So as I'm an avid reader of books, so I would like to suggest the listeners of this podcast to check out three books. Now these books are Man's Search for Meaning. Now this book, Man's Search for Meaning, is written by Viktor Frankl. So he is a Holocaust survivor. And the essence of the book is, if you know the why, you can live anyhow. So this person was separated from his family, from his wife, and for him, the why was to get reunited with his wife, and that why let him survive all the how, all the atrocities which were committed in that concentration camp. Second book which I would like to refer is by Louis Hay. Now, Louis Hay is a well-known name. She has written a book called "You Can Heal Your Life." Now, this is not a book for everyone, because a lot of people generally who have a scientific temperament would not like to read these kinds of self-help books which have like grandiose ideas about diseases, that this is the cause of your disease, because she is not talking from the lens of medical research, but more from an intuitive and a natural way of healing. Now, the third book which I would recommend is When All Is Not Well. So this is written by someone uh, who was a businessman first, then he became an expert meditator. Now, his quest of meditation was not mental health. His quest of meditation was to understand religion and spirituality. So, as in India, whenever you go in that path to become a Swami, you wear ochre robe. So he is a guru, but he is not your regular guru. He is everybody but a regular guru. So he writes books. He keeps a tab on his health. He runs a proper business as well now. So that business is uh, on how do you use the internet to help people? How do you make them uh, gain positive things from the internet? So he has a social media app called Wilder. Then there's a meditation app called Black Lotus. So he's not pushing any religion on those apps. He's just asking people to stay fit mentally and in all other aspects of life. Now, obviously, the book is about depression and how depression is not sadness. So that is why I would recommend this book, because there are many layers to this book. First, it is written by someone who is coming from a conventional background. He is a guru, for God's sake. And then he's talking about depression. And then he's giving you the rigorous treatment of it, that it is not a sad state, it's a condition. You have to become aware of what is the condition. And then he also gives you some kind of advice at the end of it. So all in all, I would say these three books are of very different people. I mean, I have read all these three books and I appreciated all of them, but I feel that not all of the books will resonate with all people. You might like Man's Search for Meaning by Viktor Frankl better, or you might enjoy You Can Heal Your Life by Louis Hay, or When All Is Not Well by Om Swami could be the book which you're reading right now. So this is how I would like to end my, advice, or these would be my last words on World Mental Health Day. Uh, Thanks a lot for having me, Poorti, and I wish that it was a good, engaging session for you as well. And I'm really hoping that all the therapy and psychiatrist sessions that which you have been taking um, is helping you and will keep on helping you. And um, yeah, that's about it.
Thank you, Ashish, for talking to us and giving us these wonderful book suggestions. So one recommendation from my side is the WHO Mental Health Guide, which I'll share the link to download. Okay. And with that, it's a wrap. And I hope you all will take good care of your mind and body.